Hi, I'm Dr. Jay Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world, and I give you expert insights on infectious diseases and public health. Today, my guest is Dr. Tom Farley, a leader in public health practice for several decades, most notably as the health commissioner for the New York City Health Department and Philadelphia Health Department. Our topic today is one that is dominating the news: discussions among parents and shaping national policies on vaccines and environmental health. That topic is autism. Now, while Tom and I are not experts in mental health or developmental diseases, we are physicians, epidemiologists, and public health leaders who have been working on health issues for decades. We know how to look at data and answer the types of questions we all care about. We know how to assess the quality of the evidence, to think clearly about causation, and evaluate how to make decisions based on this analysis. So, in the first part of our series, we're going to be asking the question: is there an autism epidemic? In the second episode of this series, we're then going to ask the question: if vaccines are not the cause of an autism epidemic, what are the possible causes? So, let's get started. Tom, thank you very much for joining me today.
Good afternoon. Good to be here.
So I know you've been spending a lot of time digging into this issue because obviously it is one that has been, dominating news discussions, parent discussion boards, and the word out of the federal government is that there is an epidemic and that it's going to be solved in the next couple of months. That's what prompted, I think, the two of us to have this discussion. And so I wanted to start today with first the most basic question: what is autism?
Autism is a developmental problem, a neurodevelopmental problem with children that is characterized by having two main groups of symptoms. First is having a problem with social interactions or communication, where children just don't interact or don't prefer to interact with other human beings or don't communicate. They may not speak at all, and they may speak in very limited ways. And the second symptom is having restricted interests or repetitive movements. May do the same thing all day long or flap their hands and look at their hands all the time. There's some very characteristic patterns of autism. So those two symptoms can be occurring in a child that has intellectual disabilities, sometimes severe intellectual disabilities, or they can be in someone who has a normal intelligence or even be highly intelligent. So there's really a range and a spectrum of autism.
Well, that's the phrase that we hear all the time, right? There's even I think a Netflix show, Love on the Spectrum, like the autism spectrum. And I think that is actually one of the biggest challenges that we face, is, when we think about autism from a public health perspective, or we think about any health condition as a public health perspective, the most important thing we can do in public health is count diseases, right? We can count the number of people with an instance of disease, and then we can look at the trends. How are those numbers changing over time? How are they changing in different places? What are the different populations impacted? So if autism is, in fact, as we all know, a spectrum of a condition, how do we actually decide what to measure? What is the case definition that we can use to actually count cases accurately?
And it's hard because there's no laboratory test that can say this child has autism. So different research groups have different methods, but the basic approach is to have some behavioral health, mental health specialists see those two criteria in a child and make the diagnosis. And then in a good study, you'll have a second level review by researchers who look across that information provided to them by many mental health or behavioral health specialists and try to ensure consistency in how you classify a case or non-case. No matter how you do it, it's going to be somewhat of a soft definition, but then nonetheless, you can try to be as consistent as possible to measure trends.
Yeah, I mean, I think this is really, really tricky, right? Because you see people all the day. I mean, I, as an adult, run into people that, the most common phrase you now hear at least among adults, is neurodivergence, right? It's trying to draw a distinction between, is this a developmental disability or is it a developmental difference? And I think that then, of course, then gets into this question about measurement aspects. And do the experts who are reviewing these records? I mean, do they have? Is there? We call this term inter-rater variability, right? Like, are the two people, when they look at the same case, are they coming to the same conclusions? Do we know much about that?
Well, in the well-known studies, including the CDC's Autism and Developmental Disability Monitoring Network, there are lots of very careful procedures to have multiple people review the same record and do various steps like that to try to ensure consistency. You can never be 100% consistent, but they can certainly try. And I think based upon that, they've probably done a pretty good job with it. Nonetheless, it is true that we have milder cases today that never would have been called autism in the past. But we also have more severe cases today, people with an IQ of less than 70, children who don't speak at all, that clearly would have been recognized in the past that are being recognized today. So we are seeing, jumping ahead a little bit, we are seeing increases in the entire spectrum, not just on the milder end of the spectrum.
Okay, so let's get into that a little bit. So, now that we have a case definition and we have some confidence that, in expert hands, in study settings, that you can accurately classify a person as having autism or not having autism, how do we, find out about these cases? How does public health count them? Like, just to give the viewers an obvious, sort of an example, the way we know about the number of cases of, let's say, HIV in a community is that laboratories are required to report. So HIV is diagnosed using a laboratory test. Laboratories are regulated by public health agencies. They are required by law. Anytime they find out about a case of HIV, they are required by law to report it to a public health agency. So that's how we can count HIV cases and be reasonably certain that we're capturing all of them. How does that actually work with autism? Let's say, for example, that I have a child that has autism. Who's doing the reporting? How are they doing the reporting, and who are those reports actually going to?
Yeah, so there isn't a national system for autism reporting like there is with HIV. And there's no laboratory test, as we said, like there is for HIV. So it's hard. So the way that we get a sense for the overall prevalence of autism is not through a national surveillance network, but through special studies. There have been individual studies done by individual researchers in a specific community where they contact doctors and schools and daycare centers and ask them to report all children with them all children that they have seen that might have autism, try to count cases. The CDC's ADDM network, they've gone to 11 sites and they all use the same basic approach, and that is gathering information from the medical system as well as the educational system. A child that may have autism that has been evaluated by a mental health specialist, and then they do the second level review. So that information really is about those 11 sites. It's not about the nation as a whole. And I should say that children, when they're a year old, you really can't tell whether they have autism or not, or usually you can at that age. It only becomes clear as the child tends to develop his ordinary, normal communication and social interactions. And so you can, to accurately really count, you ought to be counting, say, 4-year-olds or maybe even 8-year-olds, so you can really see whether they have differences or deficits compared to other children. So it's not simple, but we have pretty good measures across those now 11 sites in the ADDM network.
Okay, so let's go ahead and look at some data then. So Tom, why don't you walk us through this chart?
Yeah, one of the things that the folks at CDC have done, which is really wonderful, is they just kept a compendium of all the different studies done by different research groups across the United States over the years that try to count the number of autism cases and count the prevalence, the percent of those, or the number per thousand that have occurred in a given community. And this is just a plot of the prevalence that they've estimated by the year in which those children were born. I guess it was birth year or study year. But as you can see that there's this big increase overall in the prevalence of autism across these dozens of studies that have been taken place over the past 20 years. Now, again, each one of those studies has used its own methods. So any two studies, if you try to compare them, it's a bit comparing apples and oranges. Nonetheless, you get the distinct impression that there is an increase over time in prevalence going back, say, to the 1980s. So it's that kind of scatter in different methods that created that prompted the CDC to do this ADDM network. And so again, they use consistent methods, and they started around 2000. And now we have the next slide you can show, next graph.
Yep, let's go ahead and switch over here. Okay, yeah. So tell us what this one is showing us. How is this different than the previous one?
So these are 11 different sites in the CDC's ADDM network, or they call it ADAM network, where they're using consistent methods between sites and consistent methods over time to measure the autism prevalence. As you can see here, you have birth year here, and then you have the in which they study. They're looking at 8-year-olds, so they can be sure that if a child is only being recognized towards the later years, that they're going to be counted. And as you can see here, there's an increase of about 5-fold from 2000 to 2022, from 6.7 per 1,000 children for 8-year-olds in the year 2000. So those are kids who were born in 1992 to 32.2 per 1,000 in 2022. Those are 8-year-olds who were born in 2014. Big increase, nearly 5-fold increase during that time using these consistent methods.
So, so this is the question that keeps getting debated, and it's debated in scientific circles, it's debated in parents' blog groups, and it's debated at policy level. How do we decide how much of that increase, if any, is due to more awareness, more recognition, more diagnoses? There's a lot of discussion in parents groups about, well, we wanted our kid to get a diagnosis so they could get special services. How much of this is due to artificial increases because we're increasing our awareness and discussion? And how much do we think is actually a real increase? That in fact, there has been a real and provable increase in the number of people with this condition, regardless of how we're diagnosing cases.
Yeah, so we have the problem of increasing recognition and the criteria, which are a little bit soft. So there is the risk there. And I can actually think of three reasons why we might be measuring an increase that isn't real. One of them is just improved case finding. That is, you find children with autism now that in the past didn't come to the attention of anybody. The second possibility is what they call diagnostic substitution. A child who in the past might have been given a different label but has developmental disability, now given the label of autism, maybe because now he can get services. The third possibility is just a wider spectrum. The child who in the past would be considered normal has maybe just an odd personality, now being considered somewhere on the autism spectrum. So those are three possibilities: case finding, diagnostic substitution, and wider spectrum.
So, Tom, I'm trying to cut you off just for the average sort of watcher or listener out there. A lot of times when I do these things, I like to explain it, kind of in things that people may normally think about. And so I often think about like things like crime, where people are reading. So the three explanations you had are changes in case finding, diagnostic substitution, and a wider spectrum. So if we think, for example, let's say about like terrorism, right? One reason you may see an increase in terrorists, say in the United States, because you're hearing that a lot from the White House, is because you've changed how you're looking. You're looking more carefully. You're scanning social media. You're scanning airports, and you're finding more because you're looking for more terrorists. A second reason could be what you describe is called diagnostic substitution, is that people who were previously just considered criminals or gang members are now being called terrorists. And the third might be, in fact, that there's a wider spectrum, that now we consider terrorism to be kind of anything that's out there that we don't agree with or disagree with. Is that kind of a reasonable sort of analogy, Tom, you think?
Yeah, absolutely. So none of this is simple. And so those are three possibilities that could cause an increase in those bar charts, but that might not really reflect a change in society. But there are ways you can try to bring data into that to try to inform that and determine whether that's what's really taking place. And so let's take the wider spectrum issue. We certainly know that there are people today who are given an autism label that would not have been given a label 30 years ago. However, the ADDM network has data on how severe the intellectual disability is for the children that they count as having autism. And right now, it's about 40% of the children that are counted as having autism have an IQ of below 70. So that's pretty severe. 20 years ago, it was also about 40%. So it hasn't changed. So a widening spectrum is not causing this increase we've seen in the last 20 years. Increase in case finding, yeah, there's probably some of that. Diagnostic substitution, yeah, there's probably some of that. But to me, it's kind of hard to figure that would cause a five-fold increase. That would mean that we were missing 80% of the children with autism when we did our studies in the year 2000. When this is pretty carefully done study, pretty sophisticated folks, and people were pretty aware of autism in 2000 as well. I find it hard to believe that we could be missing 80% of the cases or changing the label of 80% of the cases back in those days.
So you highlighted, I think, what to me is probably one of the most powerful pieces of evidence, which is that in carefully designed, what we call surveillance in public health, these specialized sites where you've got highly trained people reviewing case records, making sure they have very clear diagnoses, that what you see over time is a increase, not just in all autism, but particularly you're seeing the same level and range of increase as you do in people with severe intellectual disability. And, whenever we look at, I think oftentimes infectious diseases, if you see that increase in severe cases over time, particularly for a condition like this, that really does, in a way, provide the most convincing evidence that the increase is real and not just due to us looking more or expanding the definition of what we call a case.
Yeah, to have an IQ below 70, that's a child who's not going to be able to go to school and perform like other children. So that's a child who should have come to attention even in the year 2000. And if the child was flapping his hands and had restricted movements and wouldn't communicate with other people, probably would have had a diagnosis of autism. I find it hard to believe that we missed 80% of those kids in the year 2000.
Is there any, do you know, and maybe you know, do or not know the answer, is there also some type of population representative surveys that have been done about the distribution of IQ over time that would indicate that, in fact, that the total population or percentage of the population or the prevalence of having an IQ less than 70 hasn't necessarily increased, or if it has, that's all explainable by autism?
I don't know if those such studies exist. If they exist, I haven't seen them.
Okay. Yeah. So what, I guess, so wrapping up this, we started this episode with the basic fundamental question: is there an autism epidemic? What's your conclusion looking at the data with fresh eyes?
I'm not a developmental specialist, but to me, as I look at the data as an epidemiologist, I would say highly likely we are seeing large increases in autism over the past probably 30 or 40 years.
Yeah. And I think that's important. And again, to emphasize to people out there, Tom and I are not, experts in mental health conditions or in this particular field of developmental disabilities, but we are epidemiologists and physicians and public health leaders. And it's actually, there's a real value in, somebody with Tom's level of expertise taking a fresh set of eyes at this data, because you can apply the same techniques that we use in all aspects of epidemiology, whether it's infectious diseases or environmental health, to kind of feel and to think that you can draw reasonable conclusions. And this is one of the most critical questions, that we're facing right now in public health in the United States. Is there an autism epidemic? And the answer seems to be, with a reasonable amount of certainty, yes, there is an autism epidemic. And particularly it's notable because there's been an increase in in autism cases with severe intellectual impairment. So the next question that we're going to explore, and this is going to be in the next episode that we watch, is if there is an autism epidemic, what is the cause? We're going to briefly explain, first of all, why vaccines are not the cause, and then dive into what all of the other possible causes are. So please stay tuned, hit the like button, hit subscribe, and we'll see you in the next episode where we dive into these important issues about autism in America.